is FMR, and we are the PCMC.
Mabuhay! Good morning, Philippines! Lalong-lalo na sa ating mga kababayan dito sa Eastern Visayas. To our viewers and listeners po sa Biliran, Leyte, Southern Leyte, Eastern Samar, and Northern Samar, maupay nga adlaw, maayong buntag sa inyong tanan. Maraming salamat po sa lahat ng tumututok sa ating mga episodes dito sa Dayon Kita Ha DOH. Kasama niyo po kami sa pagpapalawak ng kaalaman ukol sa mga serbisyong hinahatid po ng aming ahensya, ang Department of Health Eastern Visayas, Center for Health Development, ang ating DOH Treatment and Rehabilitation Center sa Dulag, at ang DOH retained hospitals natin dito sa Eastern Visayas, ang Eastern Visayas Medical Center at ang Governor Benjamin T. Romualdez General Hospital and Schistosomiasis Center. We are live po sa PRTV12, Favorite Music Radio 100.7 at sa official Facebook pages ng DOH Eastern Visayas Center for Health Development at ng PRTV12. In our previous episodes featuring Eastern Visayas Medical Center, nakasama natin si Family Planning Unit Head Dr. January Dukdukan at ang Social Welfare Officer 1 ng Women and Children Protection Unit na si Miss Leoma Godinez. Napag-usapan natin at naibigay natin sa ating publiko ang mga serbisyo at mga impormasyon na kailangan nilang malaman ukol sa dalawang units na ito ng Eastern Visayas Medical Center. So mga hindi po nakapanood ng ating mga previous episodes, please visit our official Facebook page ng Department of Health Eastern Visayas at look for or search for the Dayon Kita Ha DOH videos. Alright, so this morning, balik Eastern Visayas Medical Center po tayo. And this morning, we will be featuring another two specialty units or specialty centers ng Eastern Visayas Medical Center. Ang Mental Health Center o ang Psychiatry Department and the Philippine Institute of Traditional and Alternative Healthcare Unit. Sisimulan natin ang ating umaga sa pakikipag-usap at pakikipagtalakayan tungkol sa Mental Health Center at ang Psychiatric Department ng Eastern Visayas Medical Center. Kasama natin this morning, and we are so glad to have him with us, ang Medical Health Center Head and Psychiatry Department Chair, Dr. Benjamin Rodrigo Serogo. Hi Doc, good morning.
Good morning, Ma'am Jelyn, and good morning to all the listeners and watchers of this station, Eastern Visayas and all the neighboring regions of Region 8.
Alright, thank you so much. Unang-una sa lahat, Doc, we would like to thank you for sparing us your time. We know how busy yung inyong department or yung center ninyo po sa Eastern Visayas, and you coming here to PRTV12 and sharing us with your time. Maraming salamat po, kasi it would mean na marami sa ating mga kababayan dito sa Eastern Visayas ang makakatanggap na naman ng panibago at karagdagang impormasyon tungkol sa mga serbisyo na inihahatid po ng inyong hospital at Eastern Visayas Medical Center. So, thank you so much, Doc. Alright, so Doc, simulan na natin. Paano or bakit po in-establish yung ating medical center or yung psychiatry department or yung unit po ninyo sa Eastern Visayas Medical Center?
Sa una sa lahat, gusto ko lang mapaaralan yung lahat at masabi ito na ang health or pangkatawan, kalusugan, ito ay nagsasabi, our own understanding, that ito lang ay tungkol sa physical or sa katawan natin. But gusto ko ipaalam sa lahat na hindi lamang ang isang tao ay tungkol sa katawan at lahat ng mga sakit na tungkol sa katawan. Ito rin ay tungkol sa pag-iisip. So, mas na-pronounce ito ngayon sa COVID pandemic. Marami ang nagkaroon ng mga problema sa pag-iisip. Kasi yung problema sa pag-iisip ay hindi lamang yung tinatawag natin sa ating local na dialect na nalulurong or sa Bisaya na buang. Okay? All the others, especially anxiety and depression, nga walang katumbas na pananalita, di ba? When we say anxiety, hindi natin alam ano yan, di ba? When we say depression, parang borrowed, this anxiety, depression, they are borrowed words. Okay? So, going back to your questions, psychiatry service in Region 8, in EVMC particularly, has been present since 1975. Okay? There was an outpatient department, there was a ward before. However, during the middle of 1980s, the ward was dissolved. So, EVMC, yung service lang na binibigay ay sa outpatient department. So, dahil sa bagyong Yolanda, na marami ang tumulong sa atin, international NGOs, and all the other local government offices, napansin nila na wala tayong mental health wards. Okay, nagtatanong sila, yung Tacloban City, meron ba? Wala. Yung province of Leyte, meron ba? Wala. And all the other provinces in Region 8. So dahil doon, nagawa ito na maglagay tayo o magbukas ulit yung mental health ward. So aside from the outpatient services, binuksan natin yung mental health ward, ang tawag natin acute crisis intervention service na ward. It's a 10-bed ward with 1 psychiatric emergency bed to cater to our people. Pero, alam mo, yung population ng Region 8 is 4 million. And for mental health, we only have 10 beds at present. Okay? At EVMC Magsaysay, where the psychiatry department is located and the ward is located, we only have 10 beds for admission. Kaya nabugso ito na ilagay ang psychiatry or mental health center. Ang purpose talaga nito, number 1, to provide mental health service to the people of Region 8. Okay? If we will go by the primary health care, it should be that mental health care service should be accessible, should be acceptable, should be available, and should be affordable. That's number 1. Number 2, ang Region 8 ay parating meron natural disaster. Mga bagyo, iba-iba. Mga floods. Marami tayo every year. So we also give psychosocial services, interventions. Okay? And the last, and we are proud na malaman ito ng lahat. Kasi hindi lang sa pasyente ito at sa mga pamilya ang service ng psychiatry department and the mental health center. It also includes for all the doctors and the nurses. That today, meron na tayong accredited residency training program. Kung saan itong residency training program ay makaproduce tayo dito ng highly skilled workers, mental health workers, okay, that can give quality care to all the people of Region 8. So, yun ang kaya nabugso ang psychiatry.
So, Doc, paano naman po yung main function or yung pangunahing tungkulin po o mga serbisyo na hinahatid po natin sa ating mga clients?
So, yung pangunahing tungkulin, of course, is to provide assessments, diagnosis, treatment to people who need mental health care service. Pero katulong dito yung mental health promotions and mental health wellness, which is the preventive aspect. Na para malaman ng tao paano mag-deal nito. So, doon sa COVID pandemic, there were some radio stations who availed of these services. Okay, there were other employees who availed of the service of mental health. So the main functions of the department or the center, mental health centers, at present, we have an outpatient service. Itong outpatient service ito is available every day except Wednesday. Okay, for old patients. So, ang outpatient ay ang mga follow-up cases. Okay? From 8 in the morning hanggang 5 in the afternoon. Pero kung bago ka, pwede ka matingnan. Okay? Every day. Okay? But you will be at the ward. You will be seen at the ward. But anyway, kung outpatient ka, gusto mong service na outpatient, matitingnan ka. Okay? We also have our Psychiatry Emergency Crisis Center. So, sino ito? Yung mga pasyente na violente, suicidal, at kailangan ng tulong ng mental health, pero hindi pa decided na i-admit. They will be placed at the PEC, ang sabag namin PEC, Psychiatry Emergency, for a maximum of 24 hours. After that, the family should decide whether to be admitted or not into the ward. The next would be the ward admissions, yung 10-bed natin. For the 10-bed ward, meron kaming mga dapat sundin. Mayroon tayong dapat sundin, okay? So, ang isa nito is you should be at the ward for 14 days. Ito talaga ang minimum and maximum period that you will have to stay in the ward. Hindi pwede na magpapa-admit ka lang ng isang araw or 2 araw para lang hotel. Hindi pwede. Sa tingin namin, it's because the medicine will work after 10 to 14 days pa. Hindi ito yung pangkaraniwan na pangsipon at panglaglat lang. Okay? Number 2, there should be 2 watchers. Hindi pwede na walang watcher. Pwede kami magpalagay ng isang watcher, pero yung watcher na yan, hindi lalabas sa ward. Maraming tatanong nito, Dr. Go, or my residents, okay? Bakit hindi na lang namin iwan yung pasyente? Of course, we don't like that. We want the family to be involved for the treatment of your patients, okay? Maraming pamilya gusto na lang iwanan ang ganitong mga pasyente. Kasi para sa kanila, wala nang pag-asa. Okay, hindi nila alam na meron tayong mental health service, meron tayong mental health treatment. Other services would be the forensic psychiatry or the medical legal cases. So, meron din tayong mga pasyente na nakukulong o na gumagawa ng marahas dahil sa sakit nila. So, for this, tinitingnan sila every Wednesday from 9 a.m. to 12 a.m. Pero dapat meron court order. At saka meron pang ibang mga requirements. Social case study. At saka yung isa is there should be an informant, family or relative. Because sometimes if the patient meron pang sakit, hindi siya makapagsalita ng maayos. So there should be somebody. Okay, so the next would be the consultation liaison. Okay, or the referrals. Referrals come in two. Okay, there are referrals within the hospital. There are also referrals coming from other centers or agencies. Okay, from other hospitals or from other local health units, or even from Good Samaritans. And the last would be, no, there are still two. Other one would be your psychological services being provided now. If you will notice, na halos lahat ng empleyado, maging gobyerno o maging private man, hinihingan na ngayon ng neuropsychological or neuropsychiatric test. Paano ito nangyari? Dahil nalaman na natin na hindi lang katawan yung health, pati pag-iisip. Okay? If pag-iisip mo ay siyempre nagkasakit, hindi ka talaga makapagtrabaho sa isang opisina. Much more than that, yung relasyon mo sa co-workers at saka supervisors mo hindi maganda. So we have that psychological service, however, by appointment only. The last would be research. Being an APEX center and being a training hospital, training department, researchers are there, okay? Researchers are there.
So, with that comprehensive po ng mga serbisyong hinahatid po ng ating unit or yung ating center, ano po yung mga or paano po natin maa-avail ang mga services na ito? Paano po yung ating mga nakikinig at nanonood ngayon makaka-avail ng mga serbisyong na-mention niyo po, Doc?
Sa lahat ng gusto mag-avail ng mental health service dito sa EVMC, Magsaysay, we are located at Magsaysay at the present, you just may go in as walk-in. Number 1. Number 2, you can have a referral from other doctors or from other departments or from other agencies. Yun ang isa. Pag pumunta ka ng outpatient department, you will buy a card. Yun ang may bayad. 50 pesos for the card and for the chart. Okay, so for the ward, for the admission, it's upon the discretion of the resident. There is no, I believe in the ward because we are practicing still COVID precaution. You must have the vaccination card. Otherwise, if you don't have a vaccination card, you'll be placed at the PEC. Tapos, isaswab ka. Pati yung significant other, which hindi libre. Ang libre lang patient. Okay? Or you may contact us with the following numbers. At Psych OPD, it is 0905-885-0766. Or at the Psychiatry Ward, it is 0927-323-3556. Email is available and it is at psych.evrmc@gmail.com for any of your inquiries.
So, Doc, na-mention niyo po kanina, you accept walk-in and referral cases. And as the Apex Hospital po dito sa Eastern Visayas, ano yung role ninyo sa buong rehiyon when in terms of mental health or psychiatric clients?
So, we will talk about the Apex Center. Okay? Apex Center, ang ibig sabihin lang nito, Ma'am Jelyn, is ikaw yung end referral center ng Region 8. Okay, so lahat ng mga kaso na hindi na namamanage sa local level, pwede mong ipadala sa Apex Center. Pero ang nag-facilitate nito ay yung mga local health centers, local government units, and all the other private hospitals. Okay, they give out a referral form for the patient to be referred. They may also call the department in advance that they have a patient, especially those for admissions. Yun ang tawag na Apex Center. So ang Apex is like a triangle, not triangle. The base is the community, and the community comes from the different barangay. Upper, it will be your LGU, diba? So your rural health unit, from the barangay to the rural health unit, and then you bring them to the district hospital, and then if the district hospital will refer to the mental health center here in EVMC. Sometimes this is being abused. Okay? Because from the barangay level, you go straight to, it should not be, okay? For the mental health service here in Region 8 and for the mental health program here in Region 8, this protocol should be followed. Diba? Para maintindihan ng lahat, okay? That is how we work, okay? From the local. So, sa lahat ng mga taga-Region 8, halos lahat na ng LGU or rural health units, na-train na sila ng mental health gap. Mean to say, yan ang mga basic na pag-identify, pag-diagnose, at pag-manage ng mga sakit ng mental health. Okay, so it's there. Okay, that's how it goes, okay? And referral sa lahat ng mental health cases for the region.
So, napakahalaga ng mga nasabi po ni Doc Go, kasi for us to help also the center, yung mental health center ng Eastern Visayas Medical Center, we need to decongest them. So, kailangan, since equipped na yung ating mga local government units, yung ating mga rural health units ng MHGAP and other mental health interventions na I believe binibigay na ng Department of Health katuwang ang ating Eastern Visayas Medical Center, I believe we need to capacitate and apply this training sa inyong level para hindi naman masyadong magamit or ma-abuse as Doc Go mentioned yung mga services po ng higher centers, especially na mas baka ma-deprive yung mga mas nangangailangan ng serbisyo na kaya or dapat sana ibinibigay ng Eastern Visayas Medical Center. Tama po ba, Doc?
Yes, Ma'am Jelyn. And to add to that, okay, meron na tayong isang graduate ng training program, pero nandyan siya sa EVMC. Meron pa tayong 4 na graduating. Okay?
Sa ating residency.
Sa ating residency. Accredited Residency Training Program. At meron pang 3. So, naghahanap pa kami ng iba. Bakit importante ito? Because these doctors who will graduate, pwede ito ma-disperse sa region.
Yes.
And they can help as much. We can help more patients needing the mental health service.
Yeah, mas dadami pa ang ating workforce when it comes to the provision of mental health services, no? Okay, so siguro we should also invite other doctors na mag-enroll po ng mga residency programs, no? You could enroll sa ating residency program ng mental health. Tama po ba?
Thank you very much, Ma'am Jelyn.
Yes,
so I would like to take this opportunity, okay, as an advertisement to all those medical doctors who have just graduated or even those who have not graduated who wants to specialize in the field of psychiatry or mental health, that EVMC Department of Psychiatry is accepting residents for training. Thank you for that, Ma'am Jelyn.
Yes po, kasi we know how important po yung mga mental health services nowadays, diba, Doc? So, kailangan talaga natin ng more healthcare workers providing such services. Okay, so Doc, babalik po tayo sa ating mga mental health services. Baka kailangan ma-inform natin ng public, baka may mga apprehensions po sila sa pag-avail ng ating services. Magkano po yung mga serbisyo? Kung mag-avail po sila ng mga services ninyo, magkano po yung dapat nilang i-prepare para naman sa kaalaman po ng ating publiko?
Sa EVMC, we will just divide it, okay? I-divide natin. For outpatient service, I mentioned earlier na 50 pesos lang ang card. Okay? And the consultation is free. Pero yung gamot, yun ang babayaran. Okay? There are medicines being given out. Kung meron tayong program ng DOH, yung Medicine Access Program, so yan ay libre. So kung meron mga gamot na galing sa MAP, galing sa DOH, ito ay libre. However, kung mawala na yan, then it will not be free anymore. They have to buy it. That's number 1. Number 2, for those admitted. So, ang admitted patients, kung PhilHealth member ka, it is zero balance billing. So, wala talagang babayaran. However, if you are not a PhilHealth member, then meron ka ng babayaran. So, ano pang ibang gastos? Siyempre, yung mga bantay mo, hindi naman yan kasama sa mga pagkain. Okay, so you will be paying for the, for the food of your officers. Parang yun lang.
Okay. So basically, sa mga services po na ibinibigay natin lahat, yung konsulta, yung mga mental health interventions, libre po lahat. Libre. Alright, that's good news po sa ating mga nanunood at mga nakikinig this morning. Alright, so as na-mention niyo po kanina, meron tayong 10-bed capacity sa ward. Ano pa po yung mga amenities or equipment na available sa ating center para sa ating mga clients po?
So, sa mental health, pag-iisip ito eh. Okay, so although ito ay pag-iisip, meron tayong ibang mga equipment na kailangan. Dapat may laboratorio. Kasi minsan, labot lang naapektuhan ang huna-huna, baka yun ay galing sa physical na sakit. So, titingnan pa rin yung laboratory mo. That's number 1, okay? The others would be EEG. So, yung ibang nagkakaroon ng sakit ay galing sa convulsion. Okay? Parang naiiba yung pag-iisip mo, naiiba yung behavior mo. Ito ay dahil sa mga seizure o convulsion. So, meron tayong tinatawag na EEG or electroencephalogram machine para matulungan pag-diagnose. All the others are just the simple equipment. Speed mo, weighing scale, parang ganun lang.
Okay. So, Doc, yung 10 na ward, 10-bed capacity po ng inyong ward, and then you provide other services po, mga ilan po yung ating census in a day or in a month, yung average po natin na clients na nakikater natin?
For the outpatient service, we cater to about 50 to 70 patients araw-araw. Okay, for an average of like 300 in a week or 1,000 plus in a month.
Ang dami naman, Doc. Ang dami, Doc.
I feel it is not done.
Okay. Pero do we have enough workforce sa inyong center? Do we have enough psychiatrists, psychologists, nurses to provide and cater to this number?
It's never enough. Okay, we will just go by the numbers. Okay, let's say depression. 50 incidence is 15% of the population. How many is 15% of 4 million?
Yes.
Like 500.
Mga 500,000.
500,000. Okay. So for alone, for depression alone, okay, it's 500,000. 10% mga sinunta. So what is our census? It's only 50 to 70. Where are the rest? Let's just say that for the 500, only 10% of those would like to seek treatment. It is 50,000. Where are those patients? Because we only have 50 or 70 a day.
Kaya pala you said na hindi siya ganun karami as you would expect.
We would like this. That's only one, okay?
Okay.
There are 300 different mental illness aside from depression. Okay, for schizophrenia, itong sakit na pinakamalala na one of the schizophrenia type is yung taong grasa. Diba? It is 1% of the population. So 4 million, ilan ang 1%? Let's say 40,000. Where are they? Konti lang naman ang nakikita natin sa daan, di ba? And where is, di ba? 40,000 against, let's say, 1,000 a month. It's still very low.
How about sa partners po? Do we have partners with other development partners, mga NGOs or other partner agencies that provides or serves as additional workforce or additional resources, for example, supplies, kahit ganyan, may mga support na nakukuha ba ng EVMC?
So this is one of the area wherein we need to improve. Okay? So when we say workforce, being a training hospital, I don't like to call them workforce because they are studying, di ba? But they can help. Example, these medical clerks. Medical clerks are fourth-year medical students. So they rotate in our department for 2 weeks, so they can be an additional workforce. Some psychologists go to our department for their masteral. So they need hours, certain number of hours for them to complete, to become a master. So we already have that. Some of the nursing students, okay, not all, others would still like to go to Cebu, would like to go to Manila. However, I would like to tell these nursing schools that our psychiatry department is now an accredited residency training program and they can provide these services.
So, pwede na sa mga nursing.
You don't have to go to Cebu. Okay? To Cebu. Okay? To San Vicente. That was before. Okay? And it's a break. Even if you will study psychiatry, you don't study psychiatry. You go to the malls or whatever in Cebu. Okay? For the NGO partner, this is what we are looking for. The linkage. It is always there, available for us. There have been some agencies before who has worked for us, especially after Yolanda. However, at present, for a continuing NGO, whether it's international or whether it's local, here in EVMC, here in our region, we have yet to look for these partners. And it is one of the things that is a challenge to us. Okay?
And speaking of challenges, do we have any other challenges, Doc? Especially, for example, you only have 10 beds and to cater mga inpatients. Do you take that as a challenge so that mas marami pa yung ating mga clients na pwedeng ma-admit?
The first challenge, and it's a problem not only here in the region, is to break the stigma of mental health illness. Okay? Tayong mga Pilipino, mauwaw or naawod. Anong Tagalog ito? Nahihiya tayo na meron tayong mental health problem. Pero ito lang masasabi ko. Walang ni isang tao na walang problema. Okay? It may not be na malala tulad ng taong grasa, but we all have our own mental health problem. Okay? So, breaking this stigma, nakakahiya. Bakit tayo nahihiya? It is because of our culture. Anong culture natin? Yung mga ninuno natin, gusto, ang nalalaman lang nila at gusto nila na yung sakit ay katawan lang. Diba? Pag ikaw, meron kang ibang behavior ngayon, anong sasabihin? Napasmo ka, hindi ka kumain. Naayri ka. Gibarang ka. Gisaniban ka. They are all more of physical. Nakalimutan na kasama sa katawan natin yung pag-iisip. So,